Hey, everybody. My name is Margot Sangar-Katz. I'm a reporter at the New York Times, and I'm really excited to welcome you to this discussion about caregiving. We're going to start with something a little bit unusual and kind of exciting. We're going to have a performance from Sarah Jones. She's a Tony Award-winning solo performer, and she's going to be sharing excerpts of her forthcoming show called The Cost of Not Caring. So I'm going to step off the stage. She's going to come on and give a brief performance. Then we're going to come on and have the panel discussion where Sarah's going to be joined by some other wonderful experts. So, Sarah, it's all yours.
Hello, everybody. Thank you so much for being here. And please bear with me. I'll be reading. This is very new. So lovely to see some of your faces. And thank you, Aspen Health, for having me here. For those who are not familiar with my work at all, I portray characters from lots of different backgrounds based on my real multiracial family, which was also filled with caregivers. And actually, sorry. There we are. The caregivers in my family were both sort of family caregivers. Anybody here either have experience with family caregiving? Perhaps you've received care yourselves. Look at that. Right, so it really does touch all of our lives. And my family also had professional caregivers. Both my parents are doctors, my grandmother was a nurse, I had social workers. All of these kind of, whether it's health or care, it was part of my life from the very beginning. And at this moment in our history, it's never been more clear that care is at the heart of any conversation about humanity. I hope to prove that case for you. But whether it's the caregiving itself or the absence of care, which when we trace any story you can think of that's kind of got tragic outcomes or difficulties that we don't want to see, kind of continuing, we can see how much care being, not being present is there at that root. So I'm sharing all of this to say, even though we know all of this, it can still be difficult for people to give care and caregiving the gravitas that it really deserves. And so I find that perhaps if I have a very erudite-sounding British accent, that can help people sort of pay attention and take it more seriously. And then I remember that care is also about honoring all of our unique care stories in our own authentic voices, so I should just get up here and talk the way I really talk. Besides, I do speak the Queen's English. I am from Queens, New York, but now that you're all paying attention, Queens is also where I grew up caring for my grandfather who was living with a disability. I also helped raise my own siblings. I'm the oldest. Anybody relate? And in my family, which was very busy, both my parents at the hospital, my grandmother, it was just a normal thing for all of us to be in this care cycle of needing and giving. And so this experience now with you all, after performing my characters everywhere from Broadway to TED Talks, even here at the Aspen Ideas Festival years ago, and TV and film, I'm getting to develop a show called The Cost of Not Caring in partnership with the great I-Jen Poo and Caring Across Generations. Yes, so we'll all get to be on a panel together. But briefly now, I'll just introduce a few of my characters if you're up for a little Broadway on, the Aspen Mountains experience. So I'll give you just this context that my characters are loosely based on my real multiracial family. I'm talking on my mom's side, Irish, German. We have both Christians and Jews on that side. It's a long story filled with intrigue and interfaith guilt. My father, obviously I'm Black from a distance, as we like to say. My father is African American. I have Caribbean roots. I have Latine roots. I mean, basically, if you're having a rough time in the country right now or worried about certain things or you've ever been persecuted, I'm probably related to you. So with that in mind, I'll let the characters themselves speak to their care stories briefly.
Hi, everybody. It's wonderful to be here with you all. Thank you so much for caring about care. My name is Lorraine, and I'm here because of the girl Sarah Jones, who you just met. She mentioned she comes from a funny family, and she likes to say that we're all based on her real relatives, but she changes the names to protect the innocent and especially the guilty. But anyway, I am here because I am loosely based on her real great aunt. And growing up, she understood how much care mattered. I'll just give you a bit of my story. I'm not going to tell you my real age, but let's just say I like to think of myself as living proof that over 85 is the new 70. And in all seriousness, around 12 years ago, my husband was diagnosed with Alzheimer's, and I became his full-time caregiver. Now, at my age, I had always taken care of everybody, and I come from the era when the man came home and said, "Oh, you haven't done anything all day." Meantime, I was doing 10 jobs, but they just didn't call it work. But anyway, it was so difficult suddenly to find myself at this age having to care for him on my own. And I'll just say, many of you know, it's so expensive. Even if you have a little or you have enough, suddenly when care comes into the picture, you can't afford it, many of us in the country. And anyway, I wanted to care for him myself. I wished we had the home care attendant more consistently, but honestly, that time with him was some of the closest we ever were. And so I share that with you to say, years now after he has passed on, I miss being his caregiver, even as I have my own diagnosis and need my own care. And my daughter worries about me, and I don't know what to do. In a country like ours, do I go live in an assisted, it's very lonely, but I want to be in my own home. And so I'm just grateful that we're having this conversation about what the care is that we need, all of us. I know you all are so young, you're thinking, I'll never get there, but believe me, it catches up time. So with that, I will just thank you all for having this conversation, and I hope to see you as we move further into the cost of not caring.
Good afternoon, everybody. My name is Nereida. I am very excited to be here right now. I'm a little bit nervous. Whenever I get nervous, I start to talk really fast in both English and Spanish. It's very unfortunate. However, I am also here as part of the cost of not caring. As someone who, myself, I came to this country as an immigrant. I am half Dominican, half Puerto Rican, all proud. And I am also very proud of the fact that I am a professional caregiver. Like many of us who do care work, I know firsthand that, like they say, care is the work that makes all other work possible. And before you start to dispute that, think about what would happen if you didn't have your child care, your care for your aging parents, or even if you've ever been in an accident or sick yourself. You have to have those people so that the rest of your life can move on. So I share that with you to say, as a child care worker myself, I know what it is to not be able to have the child care that I need. I think it's like a Venn diagram. There's some kind of way to describe the absurdity of that. But I also want to say that the fact that our lives will come to a standstill if we didn't have care for all of these people who mean the most to us, unfortunately, that's not reflected in our economy. And the truth is, there is no economy without the care economy. So I'm hoping that that's a conversation you're going to be having today, especially the fact that it takes a pandemic for people to realize that people like us are essential. We're still essential, and we're still here needing for there to be a bigger conversation about care. So I will wrap up by saying I started out as a child care worker, and I now also have my CNA certification, certified nurses assistant. But we need so much in this conversation. We need paid family leave. I mean, when I look at every other democracy, I'm just saying, pero qué? Like, if you don't speak Spanish, I think you can still get the gist. I also want to talk about the fact that, yes, it's childcare, it is all of these other factors, the medical care that we need, but also the fact that with our aging populations and our relatives who are living with disabilities, my mom, she just turned 65, and because of how much she has been caring, unpaid for everyone, it's a 24-hour-a-day job. I can see it in her sleep, that she never stops caring for other people, and it has taken a toll on her to the point where her health needs are not being met. And it just creates a more expensive system that doesn't have to be that way if we would just go upstream in the first place. So I'm sharing all of this to say, even thinking of my mom who just turned 65, the fact that she is so depleted, it doesn't have to be that way. Like when I'm 65, I want to look like Madonna. She's probably like 65 right now. And it shouldn't be that only if you're, a pop star that you can afford to age with dignity. So here's what I want to say about that. I hope you all know this, but in the United States right now, every 8 seconds, another person is turning 65. Are you aware of that? Every 8 seconds. So that means it probably took me 8 seconds just to say that to you just now. So happy birthday to somebody. And 6, 7, happy birthday again. So if you think about it that way, this is the issue of our time. Everybody is aging, and we need the workforce to be compensated properly so that we don't have more of a drain on our system instead of the care that we should have had in the first place. That's all I wanted to say. Muchísimas gracias a todos.
What's good, y'all? My name is Rashid. I'm the only dude Savage Jones brought with her. And I just want to quickly say, because we don't have a lot of time, I want to hear the panelists. We not experts. We just here because we regular people. I'm going to let y'all know, I ain't never think healthcare would, you know what I mean? I'm in my 40s now. It's not really something that I was interested in back when I'm in the music industry, hip hop. I mean, some of y'all might not be familiar, but if you know the culture, you could have seen right away, you know what I mean, that I'm part of the hip-hop, you know what I mean, culture. I mean, first of all, I hold the microphone in the official MC posture. That's a dead giveaway right there. But also, care, that's an issue that when you're young, maybe you're not thinking about it. Now I'm in my 40s, my sciatica acting up. I'm like, what the hell? You know what I mean? The other day, my man, he was like, yo, son, AARP sent me an email. I'm like, what? Is that permission marketing? Like, what is that? I'm not even ready here for this, you know what I mean? So I'm saying, yeah, we aging, but it's not just that. We need care at every level. And I was thinking about this. I'm just going to leave y'all with this. I wrote a rhyme, and I know at this point my kids are like, Dad, you got to stop rapping. It's cringe. But the truth is, even at my age, we got to bring creative solutions to this right here. So I'm going to share something with y'all real quick, if you good with it. Y'all ready for a little hip-hop moment? All right. Aspen ideas. Here with me, Aspen health. Health is an idea. I think it still work. Here's what I'm going to say to y'all. Real quick, when I used to rhyme, the words, they mean so much. You know what I mean? It's like you need to have that understanding of why the care economy, why this matters so much to people. And I realized that word care, C-A-R-E, those letters are all in the word democracy. It's for real. So when I started to rhyme about it, I'm just going to do this real quick. I realized C to the A to the R to the E. It's like them letters that's right inside the word democracy. You can look it up. I checked a couple of times. And then my mind started coming up with one of my rhymes. That C to the A to the R to the E, yeah, that's all in democracy. Matter of fact, you can't spell a lot of things we need in this country without the C-A-R-E. Infrastructure, yeah, cares in there. Freedom and justice for all, yeah, cares in there. Matter of fact, whether you was or you wasn't aware, it ain't no America without C-A-R-E care. It ain't no America without C-A-R-E care. So, throw your hands in the air and wave them like you know we need care. Y'all can do it. Throw your hands in the air and wave them like you know we need care, all right? Y'all got your little cardio in there too, all right?
Thank you, everybody. And I'm over time, and I don't want us to lose any of the brilliant gems that you're going to hear on this panel, but I just want to share with you one last person.
Good afternoon. Maybe I can use this as an opportunity to get outside my comfort zone, as my grandkids are always telling me. My name is Hank, and Sarah Jones put me in the cost of not caring. Normally, we do not see eye to eye on political matters or any matters for that matter, but we've been talking about the fact that care touches everybody. Doesn't matter what side of the aisle you're on, doesn't matter what you believe or what you think you believe until it hits you at home. And maybe when we get on this panel, I can tell you all about my experience with my wife. But I'll just tell you that I'm a man who, I grew up in a time when, I was taught that a woman's place is in the home. I know that might not be popular now, but these days I take care of her. And that's because I want her at home. And I was never anyone, type of man who would cook, clean, all this type of thing. But let me tell you, when you love somebody, you'll figure it out. I wish we had the kind of care in this country. And I love this country. I'll never bash this country, but I do wish we had the kind of care that would lift our spirits up a little bit more. It's just me alone at home. And I'll tell you the rest when you see the full show, but let's just say her face brightens up. She feels better and looks better with makeup on, so guess who's having to look at YouTube tutorials with my granddaughter? But when you love somebody like that, it's worth it. And let me tell you, you might hear stories about how the care, it's sad and it's grieving and all that. That's part of it. But it's the joy of my life. It's the joy of my life to take care of the woman I love. And I'd love to be able to do that with some more help and some more support. Thank you all, and let's get this panel started.
Sorry, got a little stuck in my...
Oh, thanks, John.
So good.
All right, it's a tough act to follow. Thank you so much, Sarah. That was amazing.
Thank you.
I just want to briefly introduce the rest of our panel. You guys have the app, you have the program, so I don't want to waste our time with long introductions. We're going to talk for a little while, and then I know that you guys are going to have good questions. This is such a personal issue, so save up your good questions, make sure you're ready. There'll be microphones at the end, and we'll have a few minutes for you guys to participate as well. So let me introduce our panel. All the way to my left is John Kao. He's the CEO of Alignment Health, which is a Medicare Advantage plan that has some really great caregiving capabilities that we're going to talk about. Then we have Allison Applebaum, who's the Stephen S. Elbaum Family Center for Caregiving at Mount Sinai. And immediately to my left is Ai-jen Poo, who's the president of the National Domestic Workers Alliance. So let's just jump right in. I wanted to just start with some table setting. Who is doing caregiving in this country right now? I liked There's No America Without Care, so let's talk about the details. Ai-jen, could you just start out just telling us a little bit about the professional caregiving workforce? Who are the people that are doing this for their job?
Sure. Good afternoon. It's great to see all of you. Hi. So there's everybody's caregiving. We are a caregiving nation. There are 105.6 million family caregivers who are caring for older and disabled loved ones. And then we also have a caregiving workforce of 9 million across childcare and direct care. If you look at just direct care, it's about 6 million. And it's workers who both work in congregate settings like assisted living facilities and nursing homes, and also home-based care workers, everyone from professional care aides to home care, home health aides, direct support professionals, lots of names, but essentially the job is to come to your home and community and support your ability to live a dignified life with as much agency and quality of life as possible. And it's some of the most fundamental and important work in our country, and also some of the most undervalued work. The median income for a home care worker in America is $22,000 per year, with no benefits, often no access to health care or paid time off. And so if you are a care worker whose job it is to care for us, you really struggle to care for yourself and your own family doing this work. And we have the potential to change that. We could actually make a set of policy choices to make these good jobs for the 21st century that people aspire to be in and sustain in for years. And I really hope that that is our future, because we need it.
Yeah.
Allison, can you tell us a little bit about family caregiving and some of the challenges that people who are doing this kind of work?
Sure. So there are at least 53 million family caregivers, parents, partners, children, siblings, friends, neighbors, caring for individuals living with chronic and life-limiting illnesses and disabilities and mental health challenges. And these caregivers shoulder responsibilities that are physically, emotionally, socially, spiritually, existentially, and financially demanding. For too long, family caregivers have truly been the invisible backbone of the healthcare system in the United States. And as a result, these responsibilities take a profound toll. I'm a clinical psychologist by training, so I focus on mental health, which is what I want to highlight right now. We know that when we don't provide support, when distress is left untreated, it will increase exponentially across the caregiving trajectory. We know that diagnostic rates of anxiety, depression, and even post-traumatic stress disorder are higher in caregivers than the patients for whom they provide care. And this distress not only very deeply negatively impacts caregivers, and by the way, makes them at high risk for becoming the next generation of patients, but negatively impacts their ability to provide care. On the flip side, we know that when we provide support, when distress is lower, when anxiety and depression and trauma is mitigated, that is associated with reduced healthcare utilization, reduced ER visits, reduced hospitalizations, shorter length of stay if there is a hospitalization, reduced use of nursing homes, improved patient functioning, symptoms, and quality of life, and reduced mortality. Caregivers are members of the healthcare team. They need our support, and doing that is going to make a big difference for caregivers, patients, and our healthcare system more broadly.
John, I feel like your health insurance company is unusual in integrating the payment for caregiving in a way that a lot of other Medicare plans don't.
Yeah.
So can you just talk a little bit about how you've developed that and how it's worked?
Yeah, you might be wondering, what's a Medicare Advantage CEO doing on a panel of caregivers? And to give you some context, my mom took care of my developmentally challenged brother for 60 years. 60 years. And she serves as the inspiration for me now that I have to take care of her. And so when we started Alignment Healthcare, the whole context of this is to do well by doing good. Actually, do well by doing good. Give more care, not less care. And the way to do that is to have enough information to identify who that 10% of the population is that account for 80% of the spend. And then you envelop them with home-based clinical teams. And so it's going to be hard for me to get through this because what these women have talked about is moving me so much. And Sarah's title of the cost of not caring is amazing. Allison is exactly right. If you can identify polychronic conditions or early indicators earlier and earlier and earlier upstream, you have a better chance of interceding earlier to prevent chronic illness and keep people out of the hospital. Nobody wants to go to the hospital. So from the unit economic side, and now just give me 2 seconds on that, it is good business to integrate the caregiving community into the healthcare community. And we need to start thinking about that holistically. And little things, and doing little things and making sure those little things don't turn into big things requires an attention to detail. Just an attention to detail. And I think this caregiving community is going to be more and more critical to all of us as we age. And I think that's why I'm here. So.
It strikes me that this kind of caregiving that we're talking about is very little integrated into health insurance, that as a country, we don't really have very good ways of paying for it. We have Medicaid for people who are poor and often are at the end of their life or have profound disabilities, but lots of people who need caregiving just don't have like a good way of financing, and that leads to some of the problems that you guys are talking about. Why do you think that is? Like, what is the history of why caregiving is sort of off to the side of ordinary healthcare?
Well, I think that we as a country have just never really accounted for or valued caregiving. We've never invested in it. We've never fully supported it the way that it must be supported in a modern society. We are we don't have a long-term care program in the US. A lot of people assume that Medicare covers long-term care until they try to get access to it and realize really quickly that it doesn't. And so if you can't afford to pay $100,000 a year out of pocket for a room in a nursing home, really, or if you haven't bought long-term care insurance, which is very expensive and only about 1 in 10 Americans can afford it, then your only option is to deplete your assets to be eligible for Medicaid. And Medicaid was never designed to be a long-term care program, but it is what we have, and it's a huge resource for people. And even now, there are 700,000 people on a waiting list who are eligible for Medicaid home and community-based services to allow for people to, especially people with disabilities and their families and older adults, to get access to care in the home, but they can't get access to it because there's no funding or there's no workforce in those states. And now Medicaid is actually on the chopping block in this budget bill. The proposal is to cut Medicaid by almost $800 billion, which would be devastating. The impact of that really cannot be, just the ripple effects for states, for our health, for our workforce. 70% of the home care workforce is paid for by the Medicaid program. A lot of people don't realize this is also a workforce jobs program. And so there's just huge implications that are at stake. And it all does come down to this fact that we have never really, as a country, intentionally invested in our ability to get access to caregiving that is a natural part of life at every stage of life. We never know when we're going to need caregiving assistance, and we should have a system in place to support that. And instead, what we've been told is a story that it's your individual family and personal burden or responsibility, and if we struggle to afford it or manage it, we consider it a personal failure, like we didn't save enough, or we didn't buy the long-term care insurance, or we don't have the right job, or we're a bad son or daughter, when really it's not a personal failure. This is not a crisis of 100 million personal failures. There's something bigger at play here.
So we have, because everything that you're hearing, we have a benefit for home-based members that offers 35 hours a week in caregiver benefits. And we built that partly because when I had to care for my mom, we had to hire caregivers for my mom. It's all cash.
Yeah.
It's all cash pay. And I'm going, how on earth can normal people afford this?
Right.
I mean, it's a lot of money. And so the way we can afford it in the context of Medicare Advantage is because the care model is so preventative. We identify little things and we make sure they don't turn into big things. And what Allison said is exactly right. You have lower admissions into the hospital, lower ER visits, and if you're admitted, if you don't have a caregiver and you fall, that's basically how we're thinking about it. And that my mom, 93 years, falls, which she did before we got the caregiver, because she fought it. She didn't want a caregiver. And she fell. She was in the hospital for 4 days. That's $100,000 plus. Yep. Then she was in rehab and skilled nursing for another month and a half. That's another X thousand of dollars. So it actually makes sense to invest in the caregiver and to integrate that into the care delivery model. Mm-hmm. And it will save the system money.
Mm. Across medical care, there too often is an expectation that a caregiver is going to be available, and that the caregiver is going to be able to perform medical and nursing tasks, really those that are performed mostly by trained healthcare professionals, and too often without training and support. I think that's some of what you were touching on, Jen. One experience that always stands out to me, years ago in 2010 as a postdoctoral fellow at Sloan Kettering Cancer Center in New York, I was asked to review a protocol for the Institutional Review Board. And this was from the bone marrow transplant service, as they were piloting at the time their very novel outpatient and homebound transplant program, where a patient would get a transplant in the hospital and then just go home, which was incredible for patients, incredible for the health system. But you can guess who it was not incredible for. So that consent form said that in order for a patient to qualify for transplant, they needed to have a caregiver available 24/7, at least for a month at minimum, and ideally up through 100 days. I want that to sink in. What an incredible ask, right? So if we are asking family care, and this is one example of many, if we are asking family caregivers to shoulder these types of responsibilities to truly be members of the healthcare team at home, the eyes and ears of the healthcare team at home,
That's right.
then we need to do so much more to support caregivers. I often say to my medical colleagues that caregiver in the room, that parent, partner, child, sibling, friend, that's your best friend.
Yeah.
That person has the best understanding of that patient's day-to-day functioning, their symptoms and side effects, the health-related behaviors they are or are not engaging in. Patients don't want to talk about the fact that they had that extra glass of wine, or they were smoking, or they didn't take their medication, or they haven't exercised, right? But that caregiver knows exactly what's going on.
Yeah.
And so if we are going to be asking caregivers to be members of the healthcare team, then we need to now actually shine a bright spotlight on those caregivers and support them in that role.
And the needs of family caregivers and professional care workers, like home care workers, are so interdependent and interconnected. They're often pitted against each other in this kind of zero-sum equation, but in real life, we work as a team.
Yeah,
that's right.
And that's when it works best. And actually, the value of that relationship is so important for mental and emotional health reasons, but also for quality of care for everyone involved. And so I just think it's like we have to invest in family caregivers, and we also have this opportunity to invest in a caregiving workforce to support our family caregivers and do it in a way that is synced up and in right relationship. And wow, the amount of money that will save the healthcare system and the amount of opportunity that will create, and also productivity in the entire labor market, because you'll have all these working family caregivers who can actually work knowing that their loved ones are in good hands when they are not there. And it's huge.
I was going to jump in and say one of the characters I didn't get to do is based on someone who, I'm from New York. There's someone who is loosely based on my real family, but the reality is that friendship, family connection improves the overall kind of health, you were talking about the emotional toll that it's taking. My grandfather was very close, almost had a familial connection instead of that adversarial connection, and it was because he paid extra. He actually helped her be able to take care of her family, right? Because otherwise, she was with him, unable to take care of her own family. And I get stuck in her. But the other thing is that this is an opportunity for people who are skilled to be retained. Because if you are skilled, if you want someone in your home who's skilled and cares, you're going to have to pay them more than $22,000 a year. Otherwise, as Ijen was saying earlier, they're going to fast food. They can literally make more with all those skills that would be life-saving, doing something that's a waste of their skills and talents. So I think that's a huge piece.
Yep.
I want to follow up on that. Seems like a kind of work where there's a lot of potential for burnout. It's 24 hours a day for 100 days. That's a lot to ask of a family member, and it's very personal, physically intense work for a paid caregiver who's only making a pretty low salary without a lot of benefits. What do you guys think could be done that could help the quality of life for people who are providing this care?
You have a whole program.
I'll start, but
Yep.
then you can go. So back in 2010, that year I reviewed that protocol at Sloan Kettering Cancer Center. I was a postdoctoral fellow in psycho-oncology, the field of psychiatry and cancer care. And I had several experiences in addition to the one I shared that really highlighted the importance of psychosocial care. One being the fact that as I was at the time working with patients at end of life, again and again and again, those patients' narratives were not focused on their own mortality. Instead, they were focused on their parents and partners and children and siblings and friends left in the waiting room, left at home, who they were identifying as the linchpin of their care, and who they knew would be most deeply impacted by their eventual death. I also realized, despite the fact, 2010, the scientific literature had already well documented distress in caregivers. We don't need another study exploring distress in caregivers. We know that it's hard, but at the time, there were no targeted support services for caregivers in any cancer center in the United States, let alone in any healthcare system. And so in 2011, I sought to change that. I founded the Caregivers Clinic at Sloan Kettering, whose mission is to assure that no caregiver experiencing significant distress as a result of their critical role goes unidentified and deprived of necessary psychosocial services. And this is a model of care that I am now working to disseminate. My goal is that in the next 10 years, every cancer center is going to have a caregivers clinic. Within the next 25 years, every healthcare system will as well. Psychosocial care should become a standard of care for caregivers. Caregivers should not have to go outside the healthcare system where their care partners receive care for their own support. And this is a model of care, by the way, that takes a very minimal investment on the part of healthcare systems and provides incredible opportunity for training folks across disciplines and across the hierarchy in the hospital. And so I will just say, doing this work now for 15 years, again and again and again, I have seen the power of this support.
What does it cost?
Well, number one is that we register caregivers to become patients of the healthcare system, meaning they'll get their own medical record number, which means that we can bill their insurance. And most insurance, including Medicare and Medicaid, will actually cover and reimburse for these types of sessions. And so we have a model where certainly we're not bringing in the money that my medical oncology colleagues at Sloan Kettering brought in, but we're certainly in the green. And that's really, really important to know. And we also are working to ensure that for those folks who don't have insurance, that there's a mechanism for them to receive care as well. And I'll just acknowledge that over time, not only have we seen improvements in mental health and well-being, but because of the support they've received, these caregivers become active members of the healthcare team. They feel confident to engage in some of the most difficult but necessary conversations that everyone in this room, we are all gonna have to have them if you haven't had them already. Conversations about advanced care planning, goals of care, what type of care the person you love most in the world might want if they're unable to advocate for themselves. And through this type of support, caregivers feel confident. That means if and when they become bereaved, they don't have regret. Right. We can't prevent grief. Grief is normal, it's healthy, but we can prevent poor bereavement outcomes like complicated grief.
And I love this program so much. I'm so excited about its potential for scale. And for home care workers, this may sound oversimplified, but it's actually quite simple. We need to raise the wages of home care workers. We need to compensate the workforce. These should be good jobs that you can take pride in and support your family on. And one generation should be able to do better than the next. And they simply are not that right now. And it's such an incredible investment. If you think about, there's an economist at Harvard named Larry Katz who calls investments in home care jobs triple dignity investments. Because if you made them good jobs, it would enhance the dignity of those jobs and support dignity for her family and community. But then it would also enable the working family caregiver to go to work and contribute in the workforce in whatever their profession is, and that dignity. And then the job is supporting the dignity and agency and independence and quality of life of older adults and people with disabilities. It's like a win, 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 win. And it's an incredible investment in the economically, but also in the kind of social fabric of our society. And I believe, we were just talking earlier about how far this conversation about caregiving has come, even in just like the last 5-10 years, especially since COVID. And I see my friend Deb Whitman from AARP. Caregiving is a huge priority for AARP. And I believe that we could be the generation that fundamentally changes the way our country values and supports caregiving. From professional care workers to family caregivers, that is the opportunity. And literally, this is our moment.
So I promised you guys would get a chance to ask your questions. I'm going to ask one more. We've been so optimistic, but I want to inject a slight note of pessimism, and then I'm going to turn over the floor to you guys.
You're welcome.
So Ajahn, you're talking about this vision of a future in which we pay more for this care and which is disseminated more broadly. But as you also noted, we are facing legislation that could really cut back on the resources that are available to pay for it. The Congress is considering pretty substantial reductions to spending in Medicaid. And I think I should say those are not directly targeted at long-term care services, but a lot of them will hurt state budgets in a way where states might have to cut back. And I guess I'm just wondering how you think about that political setback in the context of your overall hope for the future.
I think the potential cuts to Medicaid that are proposed right now are absolutely devastating and pretty existential and in the exact wrong direction that we need to be going. We should be investing more in building home and community-based service infrastructure and strengthening the workforce, in making long-term care more affordable and accessible for more people, in supporting our family caregivers and offering respite care and so many things. And what we're doing is the exact opposite. And so I'm not gonna, there's no way to sugarcoat that. It's just, and the impact is gonna be particularly devastating in rural communities. Rural nursing homes are going to close, rural hospitals are going to be disproportionately impacted. And these are communities where there's already what they call care deserts, where it's already really hard to get access to basic services. And so I cannot overstate how scary this time is and how it's also not too late. It's not done.
Right.
And if we all had our voices heard about how important this is, we could actually make a difference. And I just want to say, we can never give up our agency in this. Caregivers teach us, right? Oftentimes we become caregivers at a moment when we feel like we've totally lost control over our lives, and then we figure out how to show up and care. We might feel like we've lost control over what's happening in Congress, but we have to show up and do something.
John, do you think there could be opportunities in Medicare for more plans like yours to kind of fill some of that gap?
Yeah, no, we were just in D.C. talking to the staffers of the Senate Finance Committee and the House Ways and Means. And to Ajah's point, I mean, they're going after $880 billion of Medicaid cuts over the next 10 years. And they're not touching Medicare Advantage,
Right.
except for some of the bad stuff that's going on in coding, which we support. I think the way to think about this a little bit differently is to think about the caregiving economy as really kind of a front end, or the upstream was the word I think Sarah used, upstream part of the member journey, that individual senior's journey. And if you can start integrating it, it really is identifying little things and making sure the little things are communicated clearly to the primary care, the specialists, and the at-home nurses. If that functions as a team, the outcome, and we're proving it, the impossible is doable. What they're suggesting is not impossible. There is hope, and it's better service. We have 2 of the 9 5-star plans in the country because of this mentality, serving the seniors. And then you have to have capital to make the investments to invest in home-based health care, combine it with home caregivers. I really think that's the winning solution. You deliver that through the Medicare funding from a policy point of view.
Okay, your turn. This woman here in the aisle, just wait for the microphone.
Thank you all so much for your perspectives. I was just curious to put this issue of caregiving, just your reaction about putting it in the broader context of, there's the things in medicine that are drugs and procedures and devices and things. And then there's a whole bunch of other stuff like this, but also nutrition science for people with intestinal problems, people who need physical therapy attempted before a surgery. Like there's a whole bunch of other service ideas that are just outside the kind of core of capital M medicine that are many times equally underserved, equally poorly compensated for the people who are involved in those, equally, sort of your argument about the economic benefits of getting serious about, the other adjuncts being a much more forceful, integrated part. So sorry to go on, but I was just curious, like, is this issue different, or is it part of this other potential theme? I'm curious.
I'd say it's zero sum in many respects. In our language, it would be you have healthcare coverage, your doctors, your hospitals, Part A, Part B, drugs, all that, that's part of it. But caregiving is in a bucket that we would call supplemental benefits. Mm-hmm. It's a big number. It's like 5 to 6% of premium now. Mm. And so what people are looking at is what programs on these supplemental benefits are actually adding value. And so, grocery benefits. So people don't have to make a decision between, food or getting insulin. Just making those decisions easier for the senior, I think does help the overall cost of healthcare. We have transportation, we have a Papa Pals, we have all that, but we just added this home giver benefit, and right now it's really for members that are homebound. They can't go anywhere, and so we have to take care of it. But if you can manage the, call it the big M properly, with prevention, by keeping people out of the hospital and keeping them happy. That's what we love about Medicare Advantage. You can't just deny care. Nobody will like you. So you have to get the star ratings. People need to like you and like the service. And you can afford that benefit then.
Who's next? Right here.
Hi, thank you. This was phenomenal. I'm Nicole Stout with the American Cancer Society. John, to your point, I think this is a public health issue, right? So it's framing this differently.
Right.
I think there is a community aspect to this. I haven't heard any of you touch on, is there corporate philanthropy that supports a community trust, that supports this caregiver ecosystem in an approach that we could leverage. It's easy to say we need more. Everybody is saying it in healthcare. Everyone's saying it in research. The pie isn't getting bigger. We have to slice it differently. And so from the medical procedure perspective, we sprint to CPT codes, right? What's the billable unit? How do we get it paid for? But there's a bigger ecosystem potentially that the community could bear and support. So I don't know if any of you have thoughts on a community-based approach that could, we talk about how important our church groups are and our extension offices in rural areas and trusted community partners and influencers. Is there a way to think differently about a funded opportunity in communities to support those types of structures?
I love it. I love that.
Make it happen.
The notion of, I said honoring my mom, to create advocacy for seniors. We're all about seniors, taking care of seniors. And the missional aspect, or the calling to serve seniors. Having gone through this caregiving situation personally, both watching her take care of my brother and me now taking care of her, it's a problem that has to be solved. And I think, what we're trying to talk to the Hill about is to think about restoring Medicare back to what, we were on a podcast with Nancy Ann DeParle earlier, and she and I worked together at a company called CareMore. But laid the foundation for what people talk about now in terms of value-based care and population health. And so it is possible, is what I'm trying to convey. And I was talking to the ARP people about this very topic like 5 years ago. Nothing's changed, really.
All right, we are running a little bit over. We're going to have one more question, so make sure it's really good.
No pressure.
No pressure.
Over here with the striped sweater.
Hi, and thank you. I was Chief of Staff for Medicare for the last 3 years, and so I appreciate, John, your perspective, because you don't hear MA plans often come with solutions to the table. But, we really worked very hard in Medicare to try to stretch our authority as thin as it possibly could go, in implementing caregiver training codes, which were kind of a new concept, and trying to integrate social determinants of health. But one thing I think that is the fundamental problem of our system is it's fragmented and siloed. And I'd be curious to hear your thoughts on, John, you kind of mentioned this, Allison, you mentioned a little bit. How do we integrate kind of the programs under the Older Americans Act with Medicare, Medicaid, private? Like, how do we start to bring all the resources that we have and maybe deliver them in more efficient?
Yeah.
I mean, this is such a great, the moment right now, so we're about to launch the guide model at Mount Sinai, New York City. So this is a guiding and improved dementia care model covered through Medicare. It's a bundle of services for individuals living with dementia and their family caregivers. It provides a robust offering of supports and services, and for caregivers, including training, education, instruction, respite, and support. I think just one thing we're learning is how the challenges we faced in identifying who's going to provide all of these services and how are they going to all come together. I certainly don't have the answer to all of this, but I've certainly for a while been thinking about the importance of our identifying the caregiver champion on the healthcare team, the point person who's going to be taking responsibility for all of the caregiver-centric services and then the patient-centric services, because otherwise what we see is the diffusion of responsibility. And when there's such diffusion of responsibility, no one takes and steps up and takes responsibility for anything.
Thank you guys so much for asking great questions. I wish we could stay and talk longer. I have a feeling our panelists will stay for a few minutes if you want to come up and chat with us. Thank you again.